Let's unpack this now with Jean Kaseya, Director General of the Africa CDC. He joins us now from Uganda. Jean Kaseya, thank you so much. Just firstly, your organization has now placed 10 additional countries at risk. This is in addition to the DR Congo and Uganda, which have already seen cases. When a country is placed at risk, exactly what are you expecting them to do?
Thank you for having me. This classification came after my meeting with the ministers of DRC, the ministers of Uganda and South Sudan today in Kampala, and a number of partners who wanted to assess the risk for other countries to be infected. And to respond to your question, we need to see this country increasing the level of preparedness. We need to see these countries putting in place strong and decentralized diagnostics mechanism, because we don't want to see any country being infected by either Uganda or DRC. It's mostly to make sure that the surveillance system will be improved in these countries.
But these countries, let's just go through them quickly. Angola, Burundi, the Central African Republic, Republic of Congo, Ethiopia, Kenya, Rwanda, South Sudan, Tanzania and Zambia. What makes these countries so much at risk right now? If we just see the map, and are we at a stage already where this particular strain, the Bundibugia, might have already crossed into those countries? We saw it with Uganda. How much risk are these countries at right now?
We saw that this outbreak started in Ituri. Now it moved to Uganda and to other regions of DRC, South Kivu and North Kivu. And that is putting clearly countries neighboring DRC at risk, because people are circulating in DRC and people are also circulating around neighboring countries. But more importantly, if countries, they don't increase their capacity to detect, they are really at risk. We are meeting South Sudan today because South Sudan is closer to Ituri and Uganda. And the minister was telling us he needs support to increase the capacity to detect and to test and to isolate people. I think this is the main message we are giving to countries. If you are around DRC, if you are around Uganda, if you have regular contact with these countries, please make sure that you increase your capacity to detect.
But how likely is that to happen? I mean, given the situation on the ground, it's not easy for these countries to actually increase their capacity, especially when you look at what's going on with these Ebola treatment centers right now being torched by local residents. How do you actually communicate that to people to say, hang on, you have to back the authorities here?
This is people are just showing us the mistrust that they are having vis-a-vis either authorities or health workers. But this mistrust we are talking about, it's also Africans vis-a-vis Western countries, because people, they don't understand. For more than 19 years that we know this disease, why we don't have vaccine, why we don't have medicine. And this is something population is saying clearly to us. And this mistrust is also to say, are we sure that with all announcements that donors are doing, are we sure that we didn't receive funding to support our operations on the ground? And, when, like the case we saw 2 days ago, when a population, they went, young people, they went to burn this health facility in Ituri, it's because a young person passed on, and they are asking why this young person didn't get all medicines, all vaccines the world is manufacturing, and why a young person can pass on, and you need to give us back the body. This is the mistrust. But what we are doing, we are telling them, we are honest with them. We say, yes, Africa was badly treated by Western countries, because if this disease was in the US or in Europe, the medicine and the vaccine would be available. But now, Africa CDC is there working with countries to deal with this issue. By the end of this year, we'll make sure to have vaccine, but for now, they have just to implement the public health measures. People are listening.
Of course, the flip side of that is that these Western countries that you're alluding to, well, they need to probably help. If what you're saying, they need to help to make sure that it doesn't come to Europe. So in effect, this is in their best interests, as far as I can understand. And you've been a big advocate for African vaccine sovereignty to help stem the spread. How likely is that Ebola strain, this particular one? How likely is it that it will come to Europe and to the United States, for instance, and what kind of measures are in place to make sure that that doesn't happen?
I was in Geneva when we decided to declare on the 15th of May Ebola, the outbreak in Africa. And the next day, I had a meeting with all ministers of health. I informed them that I'm stopping all engagement in Geneva, going back in Africa, because this is where the continent needs me. They don't need me in Geneva. They need me back to lead the response. But, when I'm talking about sovereignty, the next day before flying back, I wanted to meet President Mahama and a number of other people, because President Mahama is now a strong voice for the sovereignty agenda. What it means, sovereignty, it's not just about manufacturing health product. It's also providing domestic resources. Look, for this case, we saw, and I was clear with African countries, I will not go to partners if you don't tell me how much you are providing yourself, because the life of your people is your responsibility. DRC, they started to provide 20 million. Uganda, they provided 5 million. And before going to others, today I had a meeting with a number of African voices, Aliko Dangote, Orama, Simon Tientore, and so many others, to see how African son and sister, brother and sisters can contribute to this outbreak before going to partners. I think this is what we call sovereignty, how Africa can start to take care of Africa before seeing others coming.
And you're asking for, I can see, $319 million to help in the response efforts. How will that money be used? How much has already arrived from sponsors? And how can you ensure that it goes to the right channels?
Yes, I called for this meeting, attended by, as I said, the 3 countries and also a number of partners. It was almost 300 people who attended this meeting. So many partners wanted to bring together one plan. It's time for Africa now to start to speak with one voice, to be led by one plan, one budget. And we managed to merge the plan from DRC, from Uganda, from South Sudan, but all 10 at-risk countries. This is the $319 million we are looking for. As I said, the first source of funding is African countries. We already got around 30 million from African member states, in addition to some voluntary contribution, because South Africa gave us 2.5 million to support the response. I know other African countries, they will start to contribute also to Africa CDC to support the response. The second layer is, as I said, African voices. I'm expecting to have, I don't want to give an amount of money, but a substantive amount of money from African voices. Then partners. Let me tell you that partners, we are getting positive message from the US. Jeremy Lewin, who's leading humanitarian assistance, called me to say we are providing funding. UK, President Macron even, he sent me a message to say we'll be supporting. I'm not afraid that we'll have funding, but the most important is we need this money now to make impact on the ground. Not tomorrow, but today. We need this money.
Dr. Kaseya, this isn't the first Ebola outbreak. Obviously, we're dealing with the Bundibugyo strain, which doesn't have a vaccine, and some people are now reacting with a bit of panic. I just want to take it back to the ground. Do you think the CDC could have been better prepared, given that there is the knowledge of these strains without the vaccine?
I'm clear on that. It's unfair, the treatment that Africans are getting from Western countries. We are all human beings. We are all living in the same planet. And now, people are watching what's happening in Africa. But without vaccine, without medicine, if we don't have funding for public health measures, all of us in Europe, in US, we are at risk because this Ebola doesn't have borders. And we are saying, Africa CDC, yes, this is not the first Ebola outbreak. Yes, we didn't see Budubungyo, this trend, Budubungyo, killing like that. You know, I was showing today to all ministers that this is the second largest outbreak, Ebola outbreak in the world. The second one in terms of cases and deaths. We don't know where we are going with this outbreak. We are still on the peak of this outbreak. And we are conducting strong surveillance. Yes, Africa CDC is doing the job with WHO and other colleagues, but without tools, it's also difficult to do what we wanted to do. But we are not on panic mode. We are saying it's serious. We are addressing that, but we want people to know that if we don't do the right thing now, it will be something that maybe can lead for another headache for all of us.
Dr. Jean Kaseya, thank you so much for joining us here on France 24. All the best of luck for all the efforts there to control this outbreak, the Bundibugyo strain of Ebola, with up to 177 suspected deaths as we speak, with new cases in Uganda as well as of today. Yeah.